ADA Chapter 9, Information Management and Security. Responsibilities of the Administrative Dental Assistant. Multifaceted in the management and security of information and records. Methods of documentation vary. Principles of records management programs will always be the same. A record should remain accessible once it is created, usable, reliable, and authentic. Managing personal health information. Federal laws, HIPAA privacy, security, and breach rules, amendments brought out by HITECH Act of 2009. State laws may have additional and more stringent laws. Dental liability insurance companies have identified best practices. Protecting patient health information. Patients trust that the dental practice will maintain accurate information, protect privacy, and provide them with information when requested. Dental practice needs to follow HIPAA rules, regulations, and standards. Business associates, individuals, service providers, and others that contact with the dental practice have access to or use PHI. Examples of potential information security risks with different types of EHR host. Off-based EHRs, national disasters, you directly control security setting. Security features of EHR are not up to date. When public or private information security requires change, you have to figure out how to update your EHR. Cloud-based EHRs are dependent on reliability of internet connection, and the developer may control security settings. The developer might request extra fees to update. Privacy rule protects an individual's indefinable health information and is maintained in a clinical record transmitted by the dental practice or business associate. Privacy rules that apply to clinical records include access to clinical records, amendment of patient information, notice of privacy practices, limits on use of personal, medical, and dental information, and confidential communications. Security rule safeguards establish a national set of minimum security standards for protecting all ePHI. Administration safeguards, administrative actions, policies, and procedures. Physical safeguards include physical measures to protect electronic information systems and related buildings and equipment from hazards. Technical safeguards involves processes that protect and monitor information, access, and protect data. Organizational standards, policy, and procedures. Organizational standards require a dental practice to have contracts or other arrangements with business associates who have access to ePHI that provide specific criteria for the protection of the patient's ePHI. Dental practice is required to adopt reasonable and appropriate policies, procedures to comply with provisions of security rule. Most periodical most must periodically review and update policies and procedures. Breach notification rule. Breach is typically an impermissible use or disclosure under the privacy rule that comprises the security or privacy or PHI. When there's a breach of unsecured PHI, the dental practice must notify affected individuals, the Security of Health and Human Services, and in some cases, the media. Other laws and requirements. Many laws and requirements that protect PHI, including federal, state, or organizational. Dental practice will need to update policies and procedures regularly and provide training. Continually rise level of awareness about how to protect PHI. Cybersecurity. Top 10 tips for cybersecurity in healthcare. Establish a security culture. Protect mobile devices. Maintain good computer habits, use a firewall, install and maintain antivirus software, plan for the unexpected, control access to PHI, use strong passwords and change regularly, limit network access, and control physical access. Information management systems. Purposes of following a systematic approach. Simplify the record retrieval process, ensure the precise location of documents and records. Filing systems are used in almost all areas of daily life. Some of the filing methods we'll talk about are alphabetical, numeric, geographical, subject, chronological, and electronic. Some basic terms in alphabetical filing include indexing, which is the process of arranging a name, subject, or number, unit, number, letter, or word, or any combination the same, and filing segment, one or more units. Units in alphabetical filing: Unit 1, personal, last family name, business, business first name as written. Unit 2, personal, first name or initial of first name, business, business's second name as written. Unit 3, personal, middle name or middle initial, business, third name as written. Unit 4, personal, titles, appendages, degrees, or with business fourth name as written. Numeric filing is used for a very large number of records. Cross-referencing is a key component. Most practice management systems use a numeric system. Computer can locate patient records by entering a number or an alphabetical configuration. With geographical, subject, and chronologic filing, geographical categorizes records according to the geographic location. Subject filing allows the retrieval of information according to the subject, and chronological filing allows one to locate documents according to date, month, or year. Electronic filing: the same principles and practices used in a paper system need to be applied to an electronic system. Files are individual items such as a Word document, picture, database, or email attachment. Questions to include: where will the electronic folders be kept? How will folders and files be organized and classified? How will folders, subfolders, and files be named? Types of information: business records, accounts payable, bank statements, personal records, tax records, business reports, insurance records, and professional correspondence. Patient and insurance information, including patient information and insurance records. File types: vertical, lateral, and card. Supplies may include folders, vertical file folders, lateral file folders, guide, out guides, file labels, color coding supplies, and aging labels. Following general guidelines: check each form, mark, mark each form with the patient's name or account number, and fasten the forms in the correct order. Preparing the label: determine the indexing method, type the name or number on the label, and place the label on the file folder. Preparing paper documents for filing, inspecting, indexing, coding, filing procedures, and sorting. Record safeguarding: follow HIPAA privacy and security rules. Always keep track of records. Refile records at the day's end, and back up computer files regularly and offsite.